Hi, I'm Dr. Sabine Wünschmann. I'm an obstetrician and gynecologist, completely committed to vibrant health for women. Today I would like to take the opportunity to talk to you about this very sad subject of depression. It is something that is everywhere around us. A lot of people are really being affected by it. And I would like to share with you my experience that I have, even though I'm a gynecologist and not a psychiatrist or a neurologist. It is something that appears in my office on a daily basis. Did you know that the most prescribed drug at the age between 18 and 44 are antidepressants? This is something that always shocks me, and I think it's really discouraging to see that at the age between 18 to 44, which are the most creative years of our life, so many people are really suffering and having problems with this so-called condition depression. The WHO, the World Health Organization, which is one of the biggest organizations considering health in the world, has been running a year-long campaign with the name Depression Let's Talk. And this is really summarizes everything that I would like to pass on to you, because we need to talk. It is not something that you need to be afraid of or ashamed of. I would like you to go out there and really share with your friends, with your families, with your medical profession, with your healthcare provider. What are your symptoms and what are your worries? Don't be shy about it. It's been a recent research that shows that since the year of 2005, there's been a significant increase of depression by 18%, which is an extraordinary number, and it's really everything else we don't want. It's something that is shockingly around the world in low-income and in high-income countries. So it's not just limited to a certain class in our society, it's everywhere. And it's something that we will really, we would need to have a very open discussion and an open mind to it. Clinical depression is a serious biochemical disorder, that it has nothing to do with pull yourself together or buckle up and be, just tough about it so that you don't bother anybody else. It's a serious condition that needs to be taken as a disease. When your tooth hurts, when your joint hurts, your shoulder hurts, you would also go and seek for advice. So if you do suffer from such a disabling condition as depression, I can only beg you to be open about it. Acknowledgement is the first step. It's the first step to actually shy away from the stigma and to be able to seek advice and be motivated to get the right treatment. Our mood is talking to us in many ways, and it is sometimes, that the mood swings or the mood situation that you're experiencing has also something to do with other underlying functions. This is very important to differentiate and to also see that you have the right to find out what's going on. It's our symptom-based conventional medicine that seeks the easy way to just write out the prescription and give you the antidepressant. It's not as easy as it seems. In my clinical practice, I can see that every day, that if you balance your hormonal health, if you tackle inflammation, and if you optimize your nutrition, the situation is so much better. Your gut works better, you start producing the happy neurotransmitter serotonin that is so much important, and all the antidepressants actually work on the serotonin level. So you can do that with natural remedies and with immersing yourself in nature, with being out there, letting the sunshine see you, and being hopeful, being able to go out there and have the vitamin D rise naturally because you're out there in the nature, and that will then help you secrete your natural serotonin transmitter. Very important, very simple and very important. Don't be shy, try it, and you will see that it might make a big difference. Optimizing of the nutrition, it's something that has nothing to do with calories, but it's something that will be so helpful to you if you get your omega, your fatty acids properly, if you have a balanced diet with wholesome food and with non-genetically modified sources, it will make a big difference on your endocrine receptors so that your hormonal balance is in so much better shape, so you will feel better. I'm not saying that, there are not cases where you end up taking antidepressants. Of course, there are these cases. But in my experience as a gynecologist dealing with women every day, on hundreds of women over decades of years, that I have seen a lot of women coming off antidepressants, being themselves again, and they could just be, without it, just optimizing the things we said. So that's why I'm very, very adamant. I would like to invite you to share. I would like you to communicate your problems. Seek for help. Don't be embarrassed. And there might be a solution for you that you would not expect, as simple as it could be. Thank you very much.